Welcome back at 10:51. We are on SmartTalk1230am.com if you'd like to check us out on the web. And Tuesday, by the way, your host is Executive Editor John Arthur. Today, Richard Bean, President and CEO of the California.
Terrific. We've been talking with Dr. Brett Lehocky of Butology. He's a certified plastic surgeon about the explosion. Really, it's more of a general acceptance that it's okay to do it. And we've talked about how people of all income levels are doing it, and maybe we haven't gotten to really some of the resistance among men who feel like their wives are just fine. But we also have one of the partners, Dr. Milan Shah, on the phone. Dr. Shah, are you there?
Yes, I sure am. Hi, Richard. How are you?
I'm terrific. Look, do you have today's paper? And can you turn to my picture on my Bakersfield Observe column and see what you can do for me?
I actually looked at your picture, and I think you're beautiful, Richard. I don't think you need anything done.
I have a beautiful heart, but a face only a mother can love, okay? That's why I live alone with my cat. Welcome to the show. Now, you specialize in non-surgical procedures, right? Explain what that means.
Right, absolutely. So, my function here, along with the total of 5 docs, is I do all the non-surgical aesthetics. I specialize in a lot of skin care. We do 8 different laser types of treatments for different things, from vein removal to hair removal to sun damage improvement. We do a lot of facial fillers and Botox. So everything cosmetic you could think about without picking up a knife.
Okay, so when you say laser, are you zapping veins like spider veins, or what are you talking about?
Right. And so, again, there's different laser platforms for different targets that we're going after. But for veins in particular, we go after a lot of spider veins. The gals come in with spider veins, again, after having kids is when we commonly see them, but they come on after, if you've had a job where you've been on your feet for long periods of time. They've accumulated over time. So these lasers are actually specifically targeting those veins and shutting them off and cleaning them up. For the guys, we see a lot of men come in after, just maybe having history of a lot of sun exposure. You see a lot more of the rosacea, or that ruddiness in the face. We have a more of a superficial laser that actually targets those blood vessels around the nose and cheeks and cleans that up as well.
God, you got some work to do with me. I'm coming in. Do you do any varicose veins?
Our lasers, our cosmetic lasers, actually work primarily on the superficial spider veins. The deeper, bulgier varicose veins, I actually send out to one of our partners in town. They do more of a surgical correction of those varicose veins.
Okay. Now, what kind of, what do you see more than any? Do you see a lot of Botox?
Right. Getting back to the statistics you guys are talking about, and men in particular, I think men are very often a lot less apprehensive about undergoing non-surgical procedures. So where Dr. Lehocky was mentioning about, 5 to 6%, I'm actually seeing 1 out of every 5 to 6 patients that come into my office and to the non-surgical side as a male patient. And, I think they're willing to kind of now more than ever take that first step with some of the non-surgical procedures, because there's less downtime. They might not have to tell all their colleagues at work that I'm going to them to get some surgery done. It's a lot more concealing, and so we're seeing them come in for Botox, Dysport fillers. Hair removal is very common among the men folks. And so I think as far as statistics go, Botox and Dysport, the wrinkle relaxers, are probably the most common. Followed by facial fillers, and then the lasers are just kind of spread pretty equally.
What's a facial filler? What does that mean?
Sure. So we have 2 very common facial fillers we use, Restylane and Juvederm, and what we're trying to do is enhance volume in the face. As we age, collagen breaks down. Around your eyes start to sink in. We have these lines that go from the corners of our nose to the corners of our lips. They're called the nasolabial folds. They become more prominent. We get the lines around our lips. They're commonly referred to as smoker lines, but you don't have to smoke to get them. Well, all of these areas are.
I've got it all. I could put a pound of silly putty in the wrinkles on my face. But go ahead.
Right. So the fillers do a wonderful job filling in all those areas of lost volume, and it's in and out. You come in, other than being a little red, possibly a little bruised right after the treatment. You're okay to go right back to your regular routine shortly after.
So, how often? I guess the question for me, and I wouldn't be opposed to considering something like that, but Botox doesn't last forever. So once you get on it, how often do you have to come in town come in for a treatment if you're doing something for your eyes or your wrinkles?
Right. Well, Botox and again the other relaxer Dysport, they last initially the first time you do it about 3 to 4 months. Now it doesn't seem like a long time, but there are a couple long-term benefits I think of using these products. One, if you start them early enough, if you have a lot of expression, the frown lines, the furrow are pretty prominent, or the laugh lines are pretty prominent. Well, if you relax those muscles early on, one, you're going to be training those muscles, and we do see in a percentage of our patients, if they start early on, we train those muscles. They don't come back as strong, and so the actual procedure, the length is starting to increase. Whether it was 3 to 4 months initially, it's now 5 to 6 months, 6 to 7 months. The other good.
Oh, I would have thought just the opposite. Well, that's not bad. Okay.
Right. And the other long-term benefit is that they won't get any more imprinted into the skin. You've probably seen, colleagues or even your parents, people older that have those lines there, regardless if they're smiling or frowning or not. And you're making sure that doesn't happen. And you're also making sure you're not going to maybe need that major surgical procedure down the road. Or at least you're putting it off.
That's interesting. Do you have you guys seen much of an effect on your business because of the recession?
Well, maybe I'll answer that question. I think in our practice, we're very fortunate. The nice thing about our office is that we have the full gamut of services, non-surgical all the way to the surgical. And the one advantage of that is if I think a patient won't benefit from a laser to tighten their neck, like Dr. Lehocky just mentioned, I could refer them right over to Dr. Lehocky and give them something surgical. Maybe Dr. Lehocky could comment on the surgical aspect. I think actually in the last year, if people weren't getting those major facelift procedures,
okay, hey Doc, I'm gonna have to cut you off. We have run out of time. I want to have you back on the show, folks. If you want any kind of surgical or non-surgical stuff, go see the good people at Butology. Dr. Lehocky, thank you for coming in. Dr. Milan, thank you for calling. We're going to have you back on, okay?
Yes.
See you Monday, everybody.
Thank you, guys. Thank you. Have a good weekend.